Welcome, everyone. It's a pleasure and honor to be with you today. Not sure if it's really good morning or good afternoon or good evening from wherever you may be. Thank you for joining our panel on mental health policy and working with governments. Just a quick reminder for translation, please make sure your audio selection at the bottom of your screen by clicking the globe. Also, we encourage attendees to participate, so please submit your questions at the beginning of this panel. All speakers will have a dedicated time to answer as many as they can during the last 20 minutes or so of each panel. And also, just for your reference, all of our sessions will be recorded and accessible via our YouTube channel following the conference. Today, we will be sharing with two incredible individuals who have been empowering and transforming lives through different mental health approaches in very different contexts. I want to introduce you to Nandita Batla, Country Director in India for Corestone. Nandita, I would love it if you could tell us a little bit about yourself and the work you're doing at Corestone.
Thank you so much. It's a pleasure to be here. And maybe it's good morning, good evening for different people around the globe. So I represent an organization called Corestone. And, just quickly, I have a couple of slides which I'll show, which can take us through our work quickly. And let me know if you can see this on screen. Yeah. I hope that's visible. So,
yes.
Thank you. So Corestone literally means, it comes from the two words core and stone, which means a strong foundation to the heart. And a lot of the work that Corestone does is, it believes that mental health is more than just focus on mental illness. So using a lot of the strength-based and well-being approaches to give a holistic life to individuals. And we've been working at the nexus of well-being, gender, and education, and have a lot of programs which are based on different skills from, psychology and attitudinal healing, emotional management. But I think what I'd like to focus on today and just, go and share is our, if you can see this, I'd really like to talk a little bit about, how and why we call our work working from the inside out. And, this conference is called Reimagining Mental Health. And like I said, for us, mental health means being in a state where you feel that your sense of self is there. So it starts very much with a journey of self-discovery for an individual, where you learn what are your strengths, what are your emotions, how do you manage them, what are your goals in life, what is your purpose. And through that self-discovery, you also learn very tangible skills, which are going to put you in a mindset of growth. So this, of course, could include a lot of the regulation, emotional regulation skills, a lot of skills around conflict resolution, communication, and problem solving. And, this is just to name a few. And once the journey starts from the inside, you then start applying this kind of, self-awareness and self-confidence, I would say, to transform not only how you feel yourself and your sense of well-being, but really start applying it to your ecosystem. Because we really feel that individual transformation and social transformation must go hand in hand. And, so our inside out approach takes you from the inside to work on your relationships, your ecosystem, and at the society at large. So that's really the foundation for a lot of the programs that we do. We won't go into a lot of them, but just to share that a large part of our programs have been with adolescents in very, poor and marginalized settings in low and middle income countries. We work in India, but we also work in Africa. And I think we've been really, really fortunate because we build a lot of research into the kind of improvements that there are on mental health, physical health, gender, and education. And in two of the countries, we are actually now working with the government to go to scale, which is what brings us to this panel. And just to quickly show, this has been our journey, over the last 10, 12 years, where we started with the innovations, did a lot of the piloting and the validation of our model. And now we are poised we are in the process in Kenya to do a national scale up in middle schools, as well as in Bihar, which is the state in India, to work with the government and reach more than 3.5 million kids over the next 3 years. So I'll stop there, and then of course we can take our conversation further. Thanks so much, Natalia.
Thank you, Nandita. I would love to share right now and introduce you to Elisa Gamero. Elisa is currently working with the Salvadorian government and transforming policy within the mental health framework. So I would love it, Elisa, if you could share a little bit about your trajectory and kind of a little bit of the work that you're doing here in El Salvador.
Well, thank you so much for this great opportunity to share what we're doing from El Salvador regarding to mental health. My name is Elisa Gamero. I am an economist. Some people think that I'm a doctor, but that is because I'm very passionate about health and nutrition. That is what I do currently. I'm working at the office of the First Lady. I'm health and nutrition specialist, but previously I have a trajectory working with communities with NGOs almost for 10 years in social prevention of violence. And previous to that, with some private sector companies. But I'm very happy to be here and sharing with you what we're trying to do in El Salvador to change the life of our people and bringing some well-being regarding to mental and physical health.
Thank you, Elisa. So as we all know, mental health affects how we think, how we feel and act. It really helps determine how we handle stress, how we relate to others, and really how we make choices. It's important at every stage of life, from childhood to adolescence through adulthood. And I think COVID-19 pandemic really shed light on the importance of mental health everywhere. It is such a key issue to be considered in public policy and within governments. Elisa, you've been working for the last several years on including mental health into public policy. So I'd love for you to share, how can mental health frameworks be designed to foster this innovation and support the integrating of evidence-based practices into mental health care delivery? And I know you wanted to share a slide, so I'm going to share something.
Thank you. First of all, I would like to share with you some of our key factors to design our mental health framework. One of them, when we started working as a government, we have decided that every action that we're going to do or implement, it's going to be from the perspective of collaboratory impact. That means that we are, as a government, are one of the key actors to need to be put in place to improve our mental health. With that saying, we're very open and very flexible to hear what other experiences have been on the field for many years and taking that into our design. And of course, to listen to the rest of our partners, what evidence do they have? So for some actions that have been working and some of the results that they have been achieving to design this mental health approach. One of the key elements that evidence has shown us that works not only but for mental health, but also for physical health and having a more productive population, is that we need to start taking care of our prenatal and perinatal health. That means that we need to start from the beginning, not only from pregnancy, but also from the stage that is before that. So that's why one of our key elements is regarding to that. The other one is that for many years here in El Salvador, we don't have any access to mental health. And there have been NGOs on the field that have been providing that to our people. So what we have decided is that we're going to take all these experiences and make a better access to people to provide mental and medical health services. You could see some of the actions that we're doing regarding that. The other area that we're working very closely with other NGOs and other partners is we want to foster our healthy educational environment, not only for students, but also for teachers and caregivers. Some of you that doesn't know about our country, we have been surviving a lot of shocks. First of all, we have survived a war, a civil war for more than a decade. Then we have a silent war, the gangs, and of course, as everyone in the world, we have survived COVID. So schools are now a very important area for us to work with. So children could be feeling more safe, and of course, making them a more productive space for them, not only to achieve academical goals, but also to achieve a healthy environment. And of course, to promote social connectedness and resilience. And we are working very closely a national play strategy that when there's not going to be enough time to share it with you, but it's a very important strategy that we're implementing not only from one area, but in all the spaces that we can, so we can ensure this shows social connectedness, but also development. And also have another key strategies to address mental health in crisis and emergencies. So these are, I hope that I have been answering your question, but it's very important for us to say that there are some key factors, as I mentioned before, that have been very important for us to come to this mental health approach.
No, thank you, Elisa. I think it's exactly what we're going for, right? You are using evidence that has been built through years and years of experience from other nonprofits, even from government itself and other institutions that are implementing within the different populations. And I think it's extremely important that it's getting translated into public policy. So I think this is incredible. Thank you for sharing. I wanted to dive in, Nandita. I know you've been working for the past decades on building this evidence and implementing different resilience programs, not only within India, that's such a vast amount of individuals that you guys reach, but also now introducing different countries and different environments, right? And I wanted to kind of ask, what are the key strategies for navigating these government processes and building political will to prioritize mental health at the government level?
Yeah, thanks, for that question. And I think anyone who has, interacted with the government knows that it's a journey of, partnership that is built with a lot of patience, especially when you're outside. I know Elisa is here, who is very much within the policy space, but, journeys of organizations who are outside, I think the government have to be really built. I think building that partnership and that ownership does take a lot of patience and perseverance. But I think what is very important is how, your mindset as you go into that partnership. And I think very often for us, because we know we work with, I think Elisa also mentioned how, the educational space has become very more important to promote well-being. And, if we have to go through the educational space, there is no other system than the government education system that you have to interact with. And I believe that, whenever you are working and navigating with the government, one thing that really builds the bedrock is whether you build evidence. You've kind of, communicated that not only to the top, very often it happens that, you want to catch the person who's in charge of giving you that permission letter. But, there are tiers of stakeholders in the government. And I think each one of them is a leader in a sphere of influence in their own kind of, administrative unit. So very, very consciously, I think we have said, don't focus only on the top. Like that has been something that you build that ownership, build the sharing of information into every tier of the government. So that's something that we very consciously adopted as a strategy. And I think along with that, Dali, I know this is something that we spoke about earlier, but I really want to emphasize this as, we often see government as this, black box, which has, and we forget, like we were sharing that it's also made of people, right? People who would engage and be concerned about a lot of these issues. And I think we sometimes forget to connect. So, I think it's very important to talk to each one, to connect, to inform, to really build that sense of collective purpose, along with these people at these different tiers of, the government. And so that's something, these are a couple of things that we've done very consciously. Another thing I think that has really helped us, I mean, along with the patients, because there are a lot of transfers in the government, but we like to approach it with the attitude that, anyone who's going, if we made them our champion, they're going to be somewhere in the government championing the cause of mental well-being. So, that kind of mindset, I think, gets you out of the frustration, but really, into this building this community of stakeholders that are along with you in your journey of change. But having said that, I think, like I said, evidence is very important. Something I think with governments, and, I'm very excited that Lisa is, because, she's kind of on the other side, and maybe she can give a perspective to some of the things I'm saying from this side, is, very often, at least in India, we have seen that once you've kind of set up your program and once you've got your permissions, you forget to reconnect, to kind of circle back, to kind of give the feedback back about what is working, what is not, being really honest and transparent about where the gaps are and where you want to seek support. Because, like we do collaborations with other NGOs, I think, some of the same philosophy is very important to put into the government. And I think lastly, maybe there'll be other points that come up, but I think what is very, very key is be very aware of where are the policy hooks, which is not going to make this something that you want, but, something which that the government is committed to certain policies and certain outcomes. And this is something that doesn't work for you, but it works for them, and it works for them to showcase their commitment to whatever is there in the policy. And in India, in the last, I think, 5 years, it's been really interesting, but we've had like a National Mental Health Act. We've also had, the education policy, recognize well-being, recognize holistic development. And, whenever we go and have the conversations with the government, I think being prepared with, how is it that it's really furthering development for everyone in that state or that country. It's not about this one NGO wanting to do what they have got funds for, right? It's contributing to something bigger. So I think this kind of loop of engagement, of circling back, of keeping people informed in a true partnership, I think even with the government, that's what I feel has really helped us build this credibility and these relationships. So I'll stop here.
No, thank you, Nandita. I think it's extremely interesting because we have both worlds to a little extent, right? We're talking about, and in completely different contexts, because we're talking about India, such a humongous country, right? El Salvador is like this tiny country, but obviously one where we're having like government policy and incidents with Elisa here, and then Nandita, you with amazing programs within India and abroad. And I think something that's extremely important for both sectors and for both countries, as well as like, how can you secure government funding and sustainable resource allocation for mental health initiatives, right? Like, how can partnerships either with private sector or other foundations be leveraged to support mental health programs and services? And I think this is a question I'd love for you both to take a stab at. So maybe we can start with Elisa, since Nandita just shared before, but I'm going to open up the floor for you, Eli.
Well, for us, mental health is a transverse axis. So in every action that we have been implementing, as you already saw on our approach, you could see or you could identify mental health. But one important thing for funding is trust. You invest your money when you see that the money that you're putting in is going to give you impact and, of course, results. For us in the government, when we started, we have allocated an important amount of money, not only to mental health, but for an early childhood development program. But one of the key factors and also we have modified our laws to ensure that mental health was a very important main article in every laws that are regarding to health, but also to the development of our citizens. But going back to trust, it was very important for us to prepare the government to ensure that trust. First of all, we needed to prepare our organizational structure. We need to have the knowledge and the capabilities to respond as fast as we can to manage this amount of money. Because I remember from my experience in NGOs to manage grants, investors want results and investors want evidence of what you're doing with their money. And of course, the partners want very structured reports. So from the perspective of the government, we're not used to that. We see government as this very huge elephant that is very old and tired. So we were trying to convert that elephant into a very efficient ship that is very quick to respond. So first of all, we needed to work on the organizational structure to ensure that we have the right people on the right positions with the right knowledge to manage the funds. Second, we need to change our process, guides, all how can I say it? Yes, the processes that ensure that where the money is invested, what we're doing, the actions, and to give to a follow-up of the funds that we're implementing. Another key elements that is very important to have this funding sustainable is to have an M&E area, because in the past, governments are very effective on doing laws, but not to have a very structured system to ensure what this law is producing and the impact that it's having on their community or in their country. So I believe that has ensured us to not only receive that first money what we started, but also to continuing to attract other investors and other key actors. Is that right now, from the perspective of how we're managing funds and how we are having this accountability of the funds that we have, is that we have changed this huge elephant that is not easy, because the answer that you always receive from the government is that, but things have been always been done this way, and you're now trying to change us. But with a lot of action and always moving forward, you could change this huge elephant to build trust among investors, and of course to continuing receiving the funds. That, as I was saying, is not just only for a law to ensure that you're going to receive this amount of money or the 2% of the national budget to this action or to this approach, is to ensure that every dollar that you're receiving is well used and you can be accountable for that. So that is from our perspective.
Thank you, Elisa. Nandita, what about you?
Thank you. I think, yeah, maybe my, reflections may be a little bit more complex, because I'm looking at it from both sides, when you are talking about, whether it's securing some kind of funding from the government, which has a very different dynamic to, if you're looking for private foundations or, the philanthropic sector as well. So I think, absolutely agreeing to some, what Elisa said about trust and what I started with saying, that if it's a true partnership, that is where your sense of resource sharing starts. And for us in India, a lot of the governments don't really, they would have their own allocations for specific outcomes and for specific policies, like I said. So you have to really know, what are the kind of policy impetus or the policy outcomes that the government is committing itself to, right? And the resources that have been allocated under that, whether how can you kind of, work with the government to use those, right? And so it's not always money that you get, but it is the resources that are allocated, which, if you enter into a partnership, which are things that you can use from the government budget. The other thing that I think is very important, that very often in India, it's like the resources that you share may not only be financial resources, right? So one of the strategies that we are using, which we call institutionalization, which is the institutional systems, the setup, the structures, for example, training schedules of the teachers, materials that the government anyway prints, in like bulk numbers of millions, whether you can find a way to actually use that with the government. So your cost of what you are going to put in becomes the more technical support cost. And, you actually share the resources that the government has allocated towards like this common goal. So I think with the government, the awareness of, how budgets are made, how allocations are made, what are kind of policies which have guidelines. For example, the mental health policy recognizes the whole continuum, which goes from the promotive to the services, right? So they have guidelines that, at the block level, at the school level, what are the kind of activities that they would like to see happen? And they would have certain resources allocated under that. So that kind of knowledge, and once you build the trust, actually places you in a good way to enter into some kind of resource sharing with the government. But I think, I must confess, if I'm really, really, being very honest here, that I think with the other side, with a lot of the, private foundations, with a lot of the philanthropic side, I think there has been a great awareness about what mental health is, the fact that there is a huge need. But I think it's yet to translate into like, substantial resources and funding to go to the millions that we need. There is still, at least, and I'm talking more from India, like you see a lot of vibrancy in trying to say set up services, but they're of a certain kind, right? And there is a huge gap, and so there is some focus on that. But then there are other parts that people feel are important, but they don't really know how and what to support. So I think the funding scene, getting those kind of resources still has some way to go, as I think the understanding and also trust in this builds up. But I'm very hopeful that, with this kind of, as the conference says, is reimagining what mental health means, and, how well-being is so foundational. It's something that will change quickly.
Yeah, thank you, Nandita. I agree with you. I think mental health has always been thought about more on mental illnesses and not really on well-being in general. And I think this transition takes time. There are processes, right? And I think hopefully we're moving in the right direction. I think we are. I think there's still several crises that seem to be coming on board, particularly because of COVID and also because of technology to a certain extent within teenagers. And so I think we're going to start seeing other areas where mental health will have to be prioritized as well. I think obviously funding is always a key issue, but I'd love, Elisa, your input based on your experience. I think what are the key challenges in really implementing and advocating for mental health programming at at the government level. How do you see these challenges to be overcome? Because I know one thing is to write policy and then you have the funding, but then, okay, so how do we implement for it in a way that actually is successful? So.
Well, first of all, I believe that changing the mindset of a government, it's really difficult, and I believe that was the first challenge that we faced, because we have been taught that to process and express your emotions, sometimes it makes you weak. But we were trying to change that, and establishing that process and express your emotions makes you human. So for us, working with the different sectors, not only for health, but also to education, culture, economy, and saying that now it's important, the emotions are important, and we need to start, it sounds, I don't know if that is the correct term, but starting humanizing services and starting humanizing the access to all the protection system and all the services that we have from the government. It is a great challenge. For example, one example that I'm going to use is doctors that for years they have been taught that they should not connect with their patients, that they should not cry because of a situations regarding to their patients, and telling them that now we needed to start taking care of that, because giving birth in El Salvador was a very violent process and very silenced process, not only for women, but also for families. We have been for years saying that families are the center of a society, but we keep shouting out families from all of our services. So changing the mindset was, I believe, the greatest challenge, one of the greatest challenge that we faced, even though we have evidence-based data that says that if we want to ensure well-being in a society, we need to start to take care not only to emotions, but also to social well-being. The second challenge that I think that we faced is to select very carefully the leaders of change. In all of the sectors that we're working, health, education, protection, there have been people that all of their careers had think that we should do things differently, but they have not been listened or taking into account the ideas that they had, the innovations that they had discovered. So we have made this process to convey all of these natural leaders of change and help us going through the changes that we would like to see on all of the sectors that we're working with. The other challenge is how to establish quick wins to results that sometimes you could see 10 years from now or 15 years from now, because for these type of approaches, because all of the results are regarding to impact, they're not quickly seen, and people are driven when they achieve something. So one of our main challenges, one of our other challenges was how to establish quick wins for all of the government to see or to evidence that we have been making some progress and some change regarding of all the situations that we wanted to change. And the fourth, that I believe it was a challenge because we needed to do it in a very quickly time or timeline, was how to adjust all the guides, all the processes, all the laws, normatives, or all the key framework that was sustaining, or I don't know how that is the correct word, all the actions that the government was doing when they give their services to our population. So because they were saying, but the guide doesn't say that, but our process doesn't show us that way. So for us to change that and to give a very strong structure for us to start changing, we needed to do it that very quickly. So I can see that there were the four challenges on how to make this change into the government to start thinking or starting to see differently mental health and starting to see it as an approach from all the actions that we're doing from all different branches of the government.
No, I agree. And I think the fact that you have brought it to be a transversal theme within everything that you do is actually something that helps raise the awareness within every area that government kind of touches. And obviously being in government, a lot of policies, as you were saying, are long-term. And that's really hard for government as well, because you want to show results quicker and sooner, so that obviously there's always the re-election processes and other interests that have to play an important role. So I think establishing quick wins is truly something important. And here I kind of want to change a little bit, but I want to go into Nandita. I know you've expanded your work into different countries. And obviously, even within India, there's different needs and different populations, but you're also moving into a different political context, into different cultural norms, moving to two other different countries. And I'd like for you to share with us a little bit, how can the national mental health policies or infrastructures address these diverse needs of different populations, including marginalized communities, and how can we ensure like equitable access to quality mental health services?
Yeah, that's like, I suppose, the $1 million question between everyone, in front of everyone who's trying to work on this issue. But I just want to go back to what I started saying earlier, that I think now, with a lot of the frameworks that have come out internationally, including the, like the WHO framework, they kind of, there is a very clear recognition about the fact that, yes, different communities, or I would say different individuals in a community actually need different kinds of services, right? So it's, and that's where actually the whole impetus for focusing on well-being also has, started being more accepted. That, there is a percentage of the population along the mental health continuum that probably needs diagnosis and services, and then there is the larger part which actually may benefit from this kind of, training on resilience and, strength-based, which enhances their well-being. And, institutions around you, whether it's the family, whether it's community-based approaches, whether it's the schools for us, where a lot of our work is focused, can actually become enablers of well-being. So I think, that really, that kind of pyramid, or, whatever one can, whatever other visual one can say to that, is that, what is needed for different populations at a general level. I think that those frameworks exist, and I believe, those can be really good guiding principles for, how to program differently based on the communities that you're going in, or, whom are you planning to serve. But I think equally important, like you said, I think the manifestations of, when mental health is not looked at very carefully, or the different kinds of stigma around, talking about mental health, definitely has cultural underpinnings. And I think, as programs like ours go, I think that process of adaptation, that process of understanding the language in which well-being and mental health is addressed, also the kind of, values around, we have this, there's something that we say when we talk about the program, that yes, there are differences, but, if you dig into positive psychology, there is this whole concept that there is a universality of strengths that each one of us has as an individual. and, the values that societies across the world want for well-being. And I think, some of those theoretical underpinnings actually help you make this into something that is not coming from, an external kind of literature or an external theory, but it's very much felt and related to in different, contexts that as we expand. I think the last, one very important thing that I think, as one tries and expands and of course looks at culture and universality is also going back to the piece on governments. And, one of the, Elisa was sharing about the challenges, but I think one of the challenges we faced very early on, because this was, 10 years back, and a lot of the vocabulary or the ease with which we now talk about mental well-being was not there. I think that's maybe one little shine which has come post-COVID for us in India, at least, is that we would, so you need to know what is it that is holding people back from this acceptance of a certain kind of approach, and whether you build evidence around it. I think evidence of impact is very important. And, like I said, what governments care about, because well-being is foundational. And, whether it's a health program, whether it's a violence program, it's a girls empowerment and engagement program, so this is the aspect which we have tried to build into different kinds of development issues. And I think being aware of those links and then having the conversation with that community or that stakeholder about how it's going to take us together in the direction of impact that we want to see. So you did talk about quick wins, and I think setting up research, setting up evidence building alongside this is like absolutely critical, because it not only builds that trust, it not only shows impact, but I think it also helps to kind of, prove the fundamental nature of, how well-being needs to be foundational to many, many aspects of life.
No, I agree, Nandita. And I think in the end, we're all working towards a common goal, right? No matter where we're coming from, like that's a little bit of of what we have to keep in mind when we're trying to make a change, I think. I think we could talk for hours, but I'm going to dive into the Q&A just so that I don't leave out the questions from our participants in the panel. So Elisa, this is a question for you. And it says, how can your mental health policies be implemented in the US with our immigration population from Central America?
Could you please repeat the question again?
Sure. It says, how can mental health policies be implemented in the US with our immigration population from Central America? So maybe like, how does the mental health policies that you shared with us today, how could these be implemented in the US with the immigration population from Central America? A very easy question for me.
Well, I don't have experience within the US government, so it's very difficult for me to say what the US government should do. But what we're trying to do here from El Salvador, when you received people from our country, is trying that I will go two steps back. We have a law that it's called Crecer Juntos. In that law, in the Article 35, it's requested that all public institutions need to include in their programming or in their actions on their services mental health. So when these Salvadorians come back from the US to El Salvador, they're going to have institutions that are going to receive them with this mental health approach. And we could start working together in partnerships. Maybe that would be a suggestion, that when Salvadorians go to the US, and if the government wants, we could start working together in partnerships. But as I was saying, what we can do is when we receive them back, treat them well with our services, with access to mental health. But also what you could see in our mental health approach is that what we're trying to do is trying to prevent migration and also prevent internal displacement. What we're trying to do is make a more attractive El Salvador for our future generations to start dreaming about El Salvador and having the El Salvador dream and not the American dream. But we also understand that some families also would like to be together in the United States. So what we could offer is a partnership to try to start working together.
Thank you, Elisa. Nandit, and to kind of start bringing the conversation back, I'd love for you, if you could share a couple of successful examples of collaboration between like mental health advocacy organizations or even organizations implementing like the one that you're working in, others that you've worked with, or others that you know, and government entities, and maybe kind of share a little bit about how such collaborations can be sustained and expanded, because I think this might guide a lot of us that are in the field to have clearer or more ideas about how to keep growing what we think is important.
Yeah, I think I spoke a lot about how we try to build the collaboration with the state governments, right? With the different arms of the government. But I think one of the fundamental needs to address mental health holistically, like you talked about collaborations, is to recognize, for example, our strength comes in the promotional prevention field, right? And recognizing that, people need the services across the country. So a lot of the collaborations or, a lot of the setups is to recognize that different organizations would come with different strengths. And, not that one can become the, person who can have the expertise in all aspects of mental health. And I think those kind of collaborations where you have someone giving what we call, the end-to-end kind of services along the continuum. I mean, that is one collaboration that I think we've started to do, but I think there is a long, long way to go. And this is not, this is not only among NGOs. Like, I believe like the institutions that there are, right? So there are the schools, there are the teacher bodies, there are the counseling networks, in India. And they are trained to do certain kinds of things, but institutions is something that we very easily forget. What is the role that teachers can play? They may not become counselors, but they may need certain skills, and then they may need a referral. So I think, like with a lot of other issues, one has adopted this kind of ecosystem approach, and one has built the collaborations, up the ecosystem, or, starting from the core, going outside to including, societal and other institutions. I think that needs to be that fundamentally needs to underlie the kind of collaborations that we build. And I believe they would be more sustainable because you're also speaking to each person's strengths, but you're also recognizing that for the person on the other side, you are not building those silos of, issues, and you're not creating more problems of access. But, these kind of partnerships, I mean, like we also have a lot of partnerships with NGOs to incorporate some of this mental health and mental well-being awareness, in the work that they do. So whether it is recognizing that that's needed, say in parenting interventions, whether, that's needed among survivors of violence. So I think also trying to think how these intersections apply for different communities. I think that's another way to start setting up these collaborations. And, the sustainability part, and again come back, is that I really feel that being prepared for it to be like this, something that needs to be a long commitment, a long-term commitment, is something that we should absolutely be prepared for, because, like I think Elisa has been saying, a lot of the life events, a lot of the way that we have somehow managed to make a lot of messes on Earth, including, now climate change is something that I think we are all worried about. But yes, it's a very, very important issue. It's an emerging issue. And we already know the kind of impact, it's going to have on many things, and building resilience, building, that kind of awareness, and seeing the links with mental health is something that we should start foreseeing, what is going to come up, instead of being kind of reactive, towards and then wait for the problem to happen, and then kind of start building the collaborations around it. So I think that kind of a vision to, well-being, which transcends individuals, communities, and, ultimately government policy. I mean, I'm just so excited with everything that Elisa is sharing, because it's almost like, what she's saying, that yes, we recognize that mental health is part of all the development that's going to happen. So I guess that kind of vision lays the foundation for some of these partnerships to sustain.
Definitely, Nandita. I think we're all on the same page, and I'm going to start closing out the session, but I want to end with something you mentioned earlier, Nandita, and that I think we talked about before in our conversation as well, is that many times we talk about government and institutions as they are live entities in themselves, right? Like, oh, government, oh, and then there's a huge institution over there. Like, however, we have to be aware that they are composed of individuals, much like you and I, right? An organization at its core is its people. And I think we as individuals can't pour from an empty cup. So mental health is central to each of our well-being, and in turn, the well-being of our institutions and of our government. So I think that's something that I want to leave on the table for everyone that's here today. And thank you so much for sharing with us today, Nandita and Elisa. I think it's been a pleasure and an honor to be with you this morning and this night, because Nandita, it's night for you today. But and I hope that all the participants can join the other incredible panels that we will be having during the conference. So thank you so much. Take care. Bye-bye.